Hi everyone, I am Dr. Isha, your TTC companion. Today we are going to talk about a very sensitive and extremely important topic, that is miscarriage. I have silently gone through this pain and have felt confused, guilty, and isolated. So, my intention with this conversation is to bring clarity, compassion, and hope to all the fellow women who have had this experience. Joining me in this discussion is Dr. Sheetal Jindal. She is Director
Hello.
and Senior Consultant at Jindal IVF, Chandigarh. She has years of experience supporting women and couples through their fertility journey. Thank you so much, Dr. Sheetal, for being with us. So, before we start our discussion, I would like you to briefly introduce yourself to our audience.
Yeah, sure, Isha. So I'm Dr. Sheetal Jindal. I am currently practicing as a fertility expert and senior IVF consultant at Jindal IVF, Chandigarh. And it's been 18 years that I am practicing infertility, high risk pregnancy, and I do deal with recurrent abortions also. My keen area of interest are reproductive genetics and pre-implantation genetic testing and diagnosis.
Thank
Yeah.
you so much, Dr. Sheetal, for giving your brief introduction. So to start with, Dr. Sheetal, I have seen women who have, gone through a miscarriage, including me, that they often blame themselves for this experience.
Yeah.
So can you tell us the common causes of miscarriage?
So miscarriage is something which is routinely seen in our practice. Now, it is very common to see a female coming pregnant for the first time, and in the first 3 4 weeks of a pregnancy, when we do a scan, probably there is no cardiac activity, the fetal heartbeat is not there, and definitely that is like a very sad news which we have to declare to the patient.
Right.
So recurrent miscarriage is something which we are actually bothered about, which occurs if the miscarriage is happening repeatedly.
Yeah.
So if it is happening 2 times, 3 times, then that is definitely a very serious concern. But
Okay.
otherwise, out of all the pregnancies which we see, 10 to 20% of the females do have a miscarriage, and a single miscarriage should not actually dishearten you.
Right.
I understand that it's a very, very sensitive thing, and it's a big loss for the female. But just to reassure everyone, one should definitely be careful and investigate if it's one miscarriage, but at the same time should be hopeful that it might not get repeated in the next pregnancy.
Right. And just to reiterate on the same, that you're saying that miscarriages are quite common. So you mean that in the first trimester, the early miscarriages are quite
Yeah,
common, right?
yeah, yeah.
Okay.
And you were asking about the common causes of this early miscarriage.
Yeah.
So usually such early miscarriages happen because of some problem in the chromosome makeup of the embryo. So let's say once an embryo is formed from the egg and the sperm, and the chromosomes of the husband and the wife, they get together and form the embryo. So a lot of times, whatever early miscarriages are happening, in that there is some imbalance in the chromosomes, in the number of chromosomes, and that is what causes abortion to happen. And usually it is a chance factor, and it does not get repeated uh, in the subsequent pregnancies.
Okay. Okay.
So I very commonly say this line to females कि ऊपर वाला बच्चे बनाने का कुम्हार है, कई बार चांस से उससे भी गलती हो सकती है.
Right.
So it is something like that, that it might not happen again.
Yeah,
Yeah.
yeah. And I remember when I had my miscarriage, you were my doctor, and you
Yeah,
told me that, if it has happened once doesn't mean it will
it
happen
will
again.
happen again.
And it
Yes.
really gave me hope, during that situation, and,
Yeah.
helped me to conceive a healthy pregnancy in the next time.
Yeah.
So thank you so much for, letting us know the causes of early miscarriage. But the situation, if a woman has undergone a miscarriage, this is really overwhelming for her, right?
Definitely,
And
definitely.
she wants to know immediately what should be the next step. And she wants to know, like, when should she get herself medically evaluated if she has undergone a miscarriage.
Now, here I would like to, tell you two things. First, if a miscarriage has happened, that female needs to be handled with tender, loving care.
Yeah.
The doctor has to be very compassionate and spend some time with the couple, because it is a catastrophe for them. Now, something very important is this, that the first abortion has to be handled very carefully. There are various medical methods which can, the female can take those medicines, and she can definitely take the process of miscarriage. in 15 to 20% of cases, you might require a procedure which is called as dilatation and evacuation, which is done under anesthesia, and you have to evacuate the whatever products are there inside the cavity if it does not happen medically completely. Now, after that, there are a lot of parents who would like to know as to why this miscarriage has happened. Now, in that scenario, there are few tests like these days advanced testing is available, which is called as microarray, in which you can definitely come to know if there was some genetic problem, some chromosomal problem in the embryo, and if that is there, it gives couple a reasonable answer as to why this miscarriage has happened.
Right.
So it should be done properly under the supervision of a good gynecologist, and you can definitely test the products, the products of conception for these testing.
Okay.
Okay, and then after that, usually what we recommend is that you should give a gap of at least 2 to 3 months. A lot of couples, they even take a gap of 6 months, but
Yeah.
as a rule, after 2 to 3 months, if you want to plan your pregnancy, you can. There are a lot of couples who come to me, no, they are so disheartened that they do not want to plan it for a year or so. And that is correct, but as medically, after 3 to 6 months, you can plan your next pregnancy.
Okay, that makes sense.
Yeah.
So basically, that was my question to you. Look, how long they can wait? Because I
Yeah.
have seen women getting eager like, as
Yeah.
soon as they have had a miscarriage. And example, someone has terminated this pregnancy very early, maybe for 5 weeks or 6 weeks, or maybe it was a biochemical pregnancy.
Yes.
In those situations, what do you suggest? Do they need to wait for 3 months, or can they, plan the pregnancy as soon as they get their periods after their miscarriage?
So usually, after miscarriage, what we say is that the next 2 to 3 weeks are actually taxing for the female. So emotionally, also, she requires some time to come out of
Right.
this bad
Loss. Yeah.
loss, this bad thing which has happened. It's actually a loss. You're absolutely right. So then, usually, tell them you can plan after 3 months. Why I say 3 months is because they're eager to conceive. Now they want that something wrong has happened, so they are very, because they want to plan a family and they want to get pregnant. So minimum 3 months of time is good.
Right.
And after that, if you want to wait for a year, even that is okay.
Okay, makes sense.
Yeah.
Now, there is a lot of emphasis on diet, stress, lifestyle factors. So, do you think they really have a role to play, in diminishing the quality of the egg or the sperm, and it can also increase the chances of having a miscarriage? Or do you feel they are just overstated, things these days?
No, Isha, you've brought a very important point. I think, as a rule, I think in today's lifestyle, everybody has stress. So then we don't see every female who is aborting.
Right.
So I don't underestimate the stress component in everyone's life. Yes, chronic stress. If someone is going through a very major issue, and in those scenarios, maybe it might contribute, but that cannot be the major factor.
Okay.
But otherwise, if at all we talk about lifestyle, yes, if a female is obese, which is like being overweight, or if she's suffering from some problems like diabetes, hypothyroidism, thyroid problems, so all these things do contribute and increase the chances of abortions, and they should be definitely taken care of before the female is trying to plan her next pregnancy. And it is a good idea to go to the doctor preconceptionally.
Right.
Before they are planning their next pregnancy. In that scenario, the doctor can advise certain tests, can have a look at the reasons as to why the previous abortion has happened, and
Right.
maybe some additional testing, if it is required, can be done. And then if they plan the pregnancy, the chances of it being successful will definitely increase.
Understood. So now you have highlighted about these tests, that there are certain tests that doctor
Yeah.
can recommend. So can you tell me a brief, like give me a brief description about these tests? What are all these tests? And can a patient like me get these tests on my own before, meeting the doctor? Any situation like that can come up?
So usually, a lot of times, Isha, these there are a lot of packages, which health packages, which a lot of laboratories are offering, which includes your hemogram, your liver function test, your renal function test. So I think additional testing, which usually I recommend, is their blood sugar levels, because India is the #1 diabetes capital in the world.
Right.
So I think you should be very careful and be clear that you are not having any diabetes before you get pregnant, and
Mm.
definitely thyroid testing.
Right.
In case a female is aborting, frequently,
Yeah.
then there are certain additional testings
Mm.
which have to be done, and for that I think you should consult a doctor.
Yes.
With one abortion, it is a good idea to consult a doctor before you plan your pregnancy, so that the doctor can see and advise you in detail what is to be done.
Absolutely. And as you said, that sometime a woman can go through this particular situation again and again.
Yeah.
So when do you classify this situation as a recurrent miscarriages? Like how many
Okay.
miscarriage a woman has to go through? What are the possible reasons? And then what are the next steps for those women?
Yeah. So I think in today's world, I think every pregnancy is important.
Yeah.
But otherwise, in case there are two abortions which a female has suffered, in that scenario, we take it very very seriously and try to find out some additional causes. See, one abortion and a female recurrently aborting are two totally different scenarios. So, in case the female is aborting, recurrent, if she has undergone more than two abortions, that becomes a case for additional testing, which we try to see if there is some problem with the uterus.
Yeah.
Maybe the shape of the uterus is not all right, or if the female is suffering from some additional problems in which the blood is getting thickened inside her
Yes.
body, and
Mm.
the blood supply to the baby is getting affected.
Right.
So though, and in some cases the doctors do like to check both the partners' genetic makeup.
Yeah.
The test which is recommended is karyotype.
Right.
So these type of tests we definitely do just to make sure that this thing does not happen again. And the good thing is there are techniques available through which these problems, if picked up, can be prevented.
Okay.
So this is something which is very very important. There is no need to be disheartened in case you've undergone two abortions.
Mm.
There are ways in which we can prevent the third one from happening.
Okay. Okay.
Yeah.
So by techniques, you mean is the solution available through natural conception, or do you also mean that these couples can take support via IVF?
It depends on what the problem is. Let's say if the female is suffering from some diabetes, or if she has some problems in which the blood is getting thickened. In those scenarios, there are additional drugs which we advise to the lady, and it can help her carry the pregnancy till the end. But in other cases, in case there is a genetic problem, yes, definitely, then in those scenarios we have to look into the details of what type of genetic problem is there, if at all, if there is any, and accordingly we can advise. There are very few cases of recurrent abortions in which IVF is required.
Okay.
Yeah.
Understood. And actually, this journey is very, emotional for the
Yes,
couples and
definitely.
also
Yeah.
for the women, right?
Yeah.
So, what hope, do you want to give to these couple? Any reassuring words from your side, basis your experience, what you have seen?
Yeah. So I mentioned earlier also that these are the females who require tender, loving care. So whenever a female of who has suffered an abortion comes to me, I think it's my all empathy with them. I make the couple sit. I very gently disclose the news to them,
Yeah.
and then give them, and at the same time give them a lot of hope that this is something which can be handled. And I want to tell all the females that a single abortion, though it is a loss, but at the same time there is no need to be hopeless. You just consult your doctor, and I'm sure next time the pregnancy is coming your way. And in cases in which there is, if this type of thing is happening again and again, definitely in those cases, before you get pregnant, you must consult your doctor. A lot of times females come to me, they keep on getting pregnant earlier and earlier because they're so keen to get pregnant that they will, in the hope that next time it will click, next time it will click. But repeated abortions do affect your uterus. So in case if you think yours is this type of case, before getting pregnant, it's always a good idea that you consult your gynecologist and find out the reason, if at all any is there, so that this thing does not happen to you again. And in such scenarios also, 60 to 70% of the females are able to carry a baby back home. So this is, abortion is something which can be dealt with, and the doctors, gynecologists pan India have good experience in dealing with such cases, and there is no need to be hopeless. This is all I would say, that in a lot of cases we are able to help our patients and give them a baby.
Yeah. Just last question which is coming to your mind, and this is age specific question.
Yeah.
So in your experience, what do you think, like these days, are you seeing the cases wherein women in their maybe late 20s or in their early 30s, they are also having this experience of miscarriage, or is it just the late 30s and early 40s?
So I think Isha very rightly, very appropriate question in today's scenario. And definitely the incidence of abortions do increase after the age of 40. It
Okay.
is because the nature also gives the best eggs, utilizes the best eggs of the female when she's when she's young.
Yeah.
So after 40, definitely the average age of menopause only in India is 47, 48 years.
Mm.
And almost 7 to 10 years before that, the quality of the eggs in the ovaries, they start getting impacted. So the incidence of abortions and other pregnancy complications also increase after the age of 38 and subsequent.
Okay.
So, our age old dictum that it's a good idea to plan your pregnancy early and holds true. And it's a good idea to get pregnant as early, as possible for
Right.
a female.
Absolutely.
Yeah, yeah, yeah.
So in that scenario, when women have become so career oriented, and this is
Yeah,
my discussion with other gynecologists, they usually suggest egg freezing.
yeah.
So what are your thoughts on egg freezing?
I think so. I think this is a totally, totally different topic.
Yeah.
Egg freezing. So, female who is undergoing recurrent abortion, I think egg freezing is not for them, definitely. But egg freezing is something which a lot of girls who are career oriented, because they think that they would like to preserve their fertility.
Right.
So, female in their late 30s, after 34, and in case they think that they are not going to plan their pregnancy or get married in the next subsequent 4 5 years, yes, they can just go to the doctors and consult them, doctor, how is my reproductive health? And in case, they should have a detailed discussion with their doctors, and so that we can see and we can definitely advise them whether egg freezing is for them, or
Right.
if it is, or they can still wait for another 2 3 years. So that's
Understood.
how I think we should take the idea of egg freezing.
Understood. So thank you so much, Dr. Sheetal, for your insights and compassionate words during the conversation. I
Yeah,
hope
thank you,
this
thank you.
conversation will bring clarity and comfort to any woman who is watching this video.
Yeah.
Any concluding words from your side at the end?
Yeah, just one thing that I think abortions, uh, don't get disheartened in case you have undergone an abortion. It's not the end of the world, and just consult your doctor before you plan your next pregnancy. Be physically fit, and that goes a long way in carrying a healthy pregnancy. And one last thing which I would like to say is that taking folic acid supplements before you plan your pregnancy is something which is very, very helpful and prevents a lot of problems. And be very hopeful. I think one abortion bother, should not uh, dishearten you to that extent. And a lot of times, most of the times, the next pregnancy is usually successful.
Right. Thank
Yeah,
you so much for your words of wisdom. And just
thank you.
want to say to my audience that, having a miscarriage is not your fault. And help is always available. Doctors like Dr. Sheetal Jindal is always there to support you in this journey. And if you're residing in Chandigarh or nearby areas, I'm going to drop the details of Dr. Sheetal in the caption below. So definitely you can reach out to her. Thank you so much for watching this video, and all the best in your journey.
Thank you. Thank you
Thank
so
you.
much.
Thank